What is a retained placenta? If you're wondering what a retained placenta is and how it affects new mothers, you're in the right place. Let's break it down step by step. A retained placenta happens when the placenta, or parts of it, stay inside the uterus after the baby is born. Normally, the placenta should be delivered within 30 to 60 minutes after the baby's birth, triggered by strong contractions of the uterine muscle. Imagine the placenta as a temporary organ that helps your baby grow during pregnancy. Once the baby is born, this organ is no longer needed and should be expelled from the body. However, in some cases, it doesn't leave the uterus as it should. There are several reasons why this might happen. One common cause is that the uterus doesn't contract strongly enough to push out the placenta. This can be due to various factors, such as the placenta growing too deeply into the uterine wall, a condition known as placenta accreta, or the cervix closing before the placenta is delivered. Other factors that can increase the risk of a retained placenta include previous surgery on the uterus, like a cesarean delivery or fibroid removal, and having multiple births. Even conditions like umbilical cord abnormalities or a placenta with multiple separate lobes can play a role. So, what are the symptoms? The most obvious sign is heavy postpartum bleeding, often referred to as postpartum hemorrhage. This bleeding can be life-threatening if not managed properly. You might also experience a fever, uterine tenderness, or painful cramping. In some cases, there could be a foul-smelling discharge from the vagina or large blood clots. If you notice any of these symptoms, it's crucial to contact your healthcare provider immediately. Heavy bleeding, especially if it's saturating more than for maxi pads into hours or if you're passing large blood clots, is a red flag. If the bleeding or pain becomes severe, it's a medical emergency, and you should seek immediate help. Treatment for a retained placenta depends on the severity and when it's diagnosed. Initially, your healthcare provider might try to empty your bladder, gently pull on the umbilical cord, or encourage breastfeeding to help the uterus contract. If these methods don't work, they may need to perform a manual removal of the placenta, which involves separating the placenta from the uterus under anesthesia. In more severe cases, surgery might be necessary to remove the retained placenta. This could involve an epidural or general anesthetic to ensure you don't feel any pain. After the procedure, your healthcare provider may prescribe antibiotics to prevent infection. It's important to remember that a retained placenta is a serious condition that requires prompt medical attention. If you have any concerns or symptoms after giving birth, don't hesitate to reach out to your healthcare team. They are there to help you and ensure your health and safety.